You know, we just drove them crazy. I mean, was an MLA. I know what it would feel like to have 700 angry people arrive at your constituency office, like we organized in Fort Saskatchewan in the fall. I mean, you know, I was optimistic that it would be a good protest, but I had no idea how big it would be and how much anger was there, you know, and how much local participation there would be, you know.
What were people protesting specifically when they gathered there? I was there too, but I want you to tell me what brought them there. What was the specific threat that they were responding to right then?
They were responding to specific concerns they had about healthcare in their area, cutbacks that they could feel from anecdotal evidence when they had to get themselves or a loved one access to healthcare and it was compromised somehow. The service wasn't as good as it should be. People from the south of that Fort Saskatchewan protests were concerned about how many times they were promised a hospital, right? Sherwood Park. If you go to the site where, you know, the Sherwood Park Hospital is meant to be, you can find it probably at least a half a dozen little cornerstones that were probably ceremonially put up there, you know, every time they announced they were going to build a hospital. I mean, that's all there is the little lumps of cornerstones there. So yeah, lots of those people came. But, you know, the overriding concern was this sort of dark cloud that hung over healthcare, right? The government was up to something. We knew that they were up to something, and people didn't like what they saw, you know. And Mr. Leipert, which had, you know, the diplomacy of Fred Flintstone, right? He went as far as to say, very specifically, he said, part of the reasons we failed in our attempts to change healthcare in the past is that we revealed our hand too much. We showed our cards too much and too soon, and we're not doing that this time, right? And again, Albertans responded with, you know, I mean, for, you know, lack of a better term, right? Screw you, right? You can't deal with us like that. Yeah. You know, this is our money. It's our public health system. Sure, you're elected with your big majority, but you know, if you're going to manipulate us like that, we'll push back. And that's what you saw. And you know, we helped to facilitate the focus of that anger onto those constituency offices, but it was just there. It's like shooting fish in a barrel, right? I mean, you know, sure, we organized it, but it wasn't hard to do. We aimed specifically at the Premier, as I say, with at least 600 or 700 people there. It was an excellent protest. But we also went to the Health Minister's office that same summer. We also went to the Parliamentary Assistant for Health's office that same year as well. Same tactics, same idea, and it just drove them crazy, you know. So it's, you know, I mean, you put some credit where credit is due, and you know, I think the people of Alberta, they keep these people in line, and you know, it's yeah, they sure do. You know, we know that we're far from changing their plans, but you know, this game is everything to do with timing. And when I took this job, I distilled a very specific plan of action, and that is to try to affect or change bad policy, health policy that comes from the government, or if that's not possible, make them wear that bad policy, right? And take the blame for that bad policy. And so we've been very successful with that so far. And the second part of it is temporal, right? You make them wear bad policy or change bad policy, and you stall bad policy too, because you can only execute that kind of thing over the course of an electoral cycle in certain key spots, right? You can't bring in odious health policy towards the end of a term of your tenure before facing another election. So there's a time limit by which the government can do this, and so the third force that I play is to stall them out so they run out of time, and the cycle will continue, but we've saved the health system for another day.